This is episode 2 of Courage Speaks, and I'm your host, Sam Sherman. I'm so glad you stopped by. Courage Speaks is brought to you by Courage to Connect, an outpatient mental health center for therapy, psychological testing, and psychiatry for all ages, located in Chicago's North Shore. On this episode, I had a wonderful conversation with one of my colleagues at Courage to Connect, and I can't wait for you to hear it in just a few minutes. Meet Erin Borton, a compassionate counselor with a heart for the underdog and a passion for solving the puzzles of the human experience. Erin has vast clinical experience working with substance abuse, chronic illness, relational struggles, eating disorders, and perfectionism, just to name a few. With a career in the mental health field dating back to 2007, Erin has called Courage to Connect her home for the last 7 years, working as a mental health counselor and senior clinical supervisor, and I feel incredibly fortunate to now call her a colleague. In this episode, Erin joins us for a wide-ranging conversation where we talk about her career so far, how she has seen the COVID-19 pandemic impact the field of mental health, her strategies for practicing self-care to navigate potential burnout, and you'll even hear about her famous question that has often helped patients look at current thoughts, behaviors, and relationships to see if they're helping craft the kind of life they're seeking. Without further ado, this is episode 2 of Courage Speaks with Erin Borton. I am here with Erin Borton, who is one of my new colleagues here. Well, you're not new. You've been here for how long have you been here, Erin?
A little over 7 years.
7
now.
years. So I'm the new guy here at Courage to Connect. And when I was first kind of building out some episodes or building out some ideas for some podcast episodes, you had reached out. With a lot of interest, but you said that you haven't really heard a lot kind before.
No.
So what I guess before we dive into kind of your background, I'm curious, when you first heard about the podcast, what kind of jumped out to you about wanting to get involved?
Well, I mean, I know a lot of people listen to podcasts,
Yeah.
right? So I just haven't, getting older and not staying up with the technology or whatever. But yeah, I know a lot of people listen to them, and I think it's an important topic to talk about to get people more comfortable with coming into therapy, that it's not so mysterious or something like that.
Yeah, which is kind of a bit of a teaser for probably what we're going to talk about in a little bit, with someone kind of just getting, talking about these things, right, and the importance of that.
Yeah.
So can you give me just a little bit of your background about how you got into the field of mental health and even
Sure.
what led you here to Courage to Connect?
Yeah. So I started off in the addictions field, really wanting to help people with that, and I still do. But as I got into addictions, I saw more and more, a lot of things went in to that. So a lot of mental health issues with addictions, trauma, all different sorts of stuff. So yeah, my early years were just working in outpatient detox. And then I eventually went into residential, so through Glass House with the National Council on Addictions, and then with Hazelden and Gateway around here. Lots of good experience with that.
Yeah.
Yep.
And so how long ago was your first entry into this field?
Yeah, so let's see, it's been a while. Probably 2007.
2007.
Yep, the first time.
And do you remember, was there a moment early on where, kind of getting into the field of mental health and counseling where, some people call it the aha moment. There's the different ways to describe it, but that moment where you were I think this is what I want to do for the rest of my life, or at least, for my career.
Yeah, so when I did get into when I was in undergrad, it was not what I thought I was going to go into. I was kind of undecided and all of that sort of stuff. But I knew my friends usually would come to me. I think we all have that personality as counselors that everybody comes to us. And I'm like, this would be a bad deal.
Yeah.
Sitting down and talking to people for a living.
It's funny. Sorry to interrupt. It's funny you say that because everyone seems to have that. Everyone in this field seems to have that thing where people come up to them and they're the person that that people approach. And when that's happened, kind of over time, it's like you kind of hear that enough and hear that enough. And I always thought, because I had people like that would kind of come to me, and you think, well, it seems like anybody could just hear, listen to people, and then you talk to other people, and I've talked to friends and they're like, I could never do it.
Yeah,
it doesn't feel like that. So
yes.
So anyway, so you had people that had kind of said you were sort of that person that people would maybe go to and feel comfortable sharing and whatnot.
Yeah, I've always been a helper and a listener and encourager.
Mm-hmm.
So, yeah.
And so, tell me about your path to first getting involved with Courage to Connect.
Sure, yeah. So right before this, I worked in an inpatient mental health facility. So even with eating disorders, and self-harm and psychosis. So I got to see a really wide range. And then I was looking for something a little different and looked into private practice. They were looking for somebody specifically with eating disorder experience.
Mm-hmm.
And I thought it would be a good time to make a move.
Yeah, and 7 years later, right?
I love it here, yeah.
Mm-hmm. And so right now, something we're going to talk about today is around this topic of like stigmas in the mental health world and field. And I'm thinking, as we speak now in 2023, there's probably more than ever, but still, as I always like to say, like still a long way to go. But at least to this point in time, there's more awareness around, self-care, around acceptance in certain spaces, around seeking help and all those kinds of things. But when you first entered the field, can you describe what your perception of how comfortable that environment was for at least the people that you were working with?
So it definitely wasn't as talked about. I mean, I do work with teens and up.
Mm-hmm.
So definitely the teens, young adults, children are a whole lot more comfortable. And their parents are more comfortable taking them, especially since COVID, of course, and seeing all the mental health issues. Before then, it was just kind of like you just dealt with your issues on your own inside your family. You didn't go for help and to a counselor unless you like really needed it, you know?
Yeah.
Yeah.
So it was more like reactive as opposed to like a proactive approach to when you'd be seeking counseling.
Yeah.
And have you've seen that kind of change over time in patients that you've worked with, or even families of patients that you worked with, in terms of maybe the or how have you seen it develop in terms of like the stigmas or things that you would maybe hear previously? Has that changed?
Oh, it's definitely changed. It's talked a lot more now. I know with the introduction of like Second Step with the kids and all of that sort of stuff, they definitely didn't have that in my generation, and that sort of thing. So I think with the younger culture, they are a lot more used to talking about it and being okay with going to a therapist, and that's part of their self-care, that you don't necessarily need to have like a big problem to come. The adults, though, they're slowly coming in.
Yeah.
They're like, that's okay for my kids. I can see it's important for my kids.
It's like, how about you? And it's like, well, for my kids, it's good.
Exactly. Yeah. But again, we're seeing that change a little bit. There's definitely, again, since the COVID pandemic, even adults are like, oh, I still don't feel right. Like it had an impact, but they weren't sure. They just kind of felt off.
Right.
So even if you don't have mental health issues per se, like a diagnosis, there are like adjustment things, like things we all go through in life, that are hard, and we need somebody to help us like talk through just that space and time. Just because adults are so busy these days, like they just don't have the time to think about themselves. Right.
And so there's kind of, when you bring up like the pandemic, I'm thinking of as a counselor who was in school starting in 2020 and now practicing in 2023 for the first time. So I'm kind of a post-pandemic counselor. But for you to have started, before the pandemic, worked through the pandemic, and now I mean we're really in it still,
kind of.
but sort of past the last few years,
Mm-hmm.
or last couple of years, how have things changed, I guess, from your perception or from your perspective, from kind of that before, during, and after?
Yeah.
And I know that that's kind of a broad question, but does anything come to mind in terms of some of those? I don't even know. Like you mentioned some of the approaches of how maybe some of the adults are feeling, or the adult populations coming into counseling. But anything else that you've noticed?
I mean, I definitely think more insurance companies are noticing like the need to cover mental health, maybe that they haven't before.
Yeah.
And the introduction of telehealth. It was really before the pandemic. You didn't see it a whole lot. And so with the pandemic, obviously everything had to switch over
Right.
to telehealth for a little bit. And we just saw that people could still get really good quality of care, which was really exciting because then we can reach more people.
Right.
And not everybody's comfortable coming to a therapy office, so it was really nice to see like people in their own space and able to get maybe some help.
Yeah.
So,
It's interesting. You see, I don't know if you've experienced this of like seeing patients in person, and then in times where that you've used to seeing in person, then maybe there's one time when you see them telehealth.
Yeah.
And at least I've seen it before, where sometimes people are just in their own space, like different, like they're like sometimes a little bit more open or more comfortable,
a little more relaxed. Especially, I deal with a lot of people with anxiety too. So like coming into a new space and just sitting here like looking at each other, right? It can be a little intimidating, or like they don't know what to say. But if they're in their own environment, then it's easier. It feels more comfortable.
Yeah, absolutely. And so again, everybody's different, but it definitely seems like like you say that post pandemic, the widened accessibility, which was at first these sort of emergency things that the government implemented that I guess hopefully seem to have been sticking, and hopefully will continue to kind of widen. So going back to this I'm thinking about like a kind of an intake session with a patient who is coming in, either adolescent populations, adult populations. Is there kind of an approach that you take from an intake, from at the start of intake, to kind of work again, or kind of I don't like necessarily saying fight stigmas, but but to sort of address the potential situation of a person coming into a space that's maybe never been in counseling before, doesn't know what it's all about, maybe has an idea of what it is, or something like that. Is there something that, like an approach that you take to try to address that or work around that?
Yeah, definitely, because I mean, counseling, it is a different thing.
Yeah.
People see it a lot on TV, and they have ideas of, what it's like. So I do like to give them a little bit of an idea, just get them feeling comfortable that it doesn't need to be anything in particular.
Right, yeah.
We're just kind of sitting here talking, and it kind of just organically, can move and discuss the things that are important to them, regardless of what they've maybe come in for.
So, and I like that idea of that it doesn't have to be anything in particular, right?
Yeah.
I always think about it we kind of come in with, we've got different modalities, interventions, techniques, whatever, all these things that we can kind of come in with. But I kind of share that sentiment of starting out with a patient and kind of saying this doesn't have to look anyway. Right?
Exactly.
It's everyone's experience is going to be individual. In fact, I think that's the best way is if we can really individualize it, for each patient. But you're right. I think that the way that counseling and therapy has been portrayed, people have a certain expectation of, and that's one where I think people might think, it looks this way, and that could either be something that they expect when they show up, or a reason that they don't show up because they think that it's going to look a certain way when and maybe that is how it looks for some clinicians in some situations, but of course that's not always the case. In your bio on the Courage to Connect website, there's a sort of this magic question, or not. I don't know if it was a magic question, but the question
Yes, I know
that
what you're talking
of I believe it was, how is that working for you?
Yes.
Can you talk a little bit about that? I think that's such a cool question.
Yeah, yeah. Well, I mean, there's certain behaviors we might have developed over time that at one time worked for us.
Mm-hmm.
But because of life situations or our own growing as an individual, we might decide, again, if we're so busy, we don't have time to think about these things, and
Right.
we just keep using what we've always done before. So the question, is that working for you, really gets people to think, like, what is the pros and cons to keep doing this, and do I need to
Right.
keep doing this?
Yeah, because I think it's such a great way for somebody to like kind of have that moment of reflection where, we're like, again, in counseling, it's like we're not trying to fix things or we're not trying to tell people how to live their lives.
No, definitely
And I
not.
think that's such a great question, because it's like someone could be, there could be a behavior or a thought pattern, it's different things, and someone can be so used to that, like you said, that's what
Right.
they've experienced, and you can say, how is that working for you? And if it's working fine,
Yeah.
then great.
Then fine.
And but maybe they say, well, I don't know, it seems like it's leading to these symptoms or these feelings and all that kind of stuff. So I really like that. I thought that was such a great
Yeah.
a great kind of. Now, is that an intake, or do you just see that coming up throughout?
Just as we get to know each other and,
Yeah.
and work through things, it'll definitely come up.
Right.
Because, like you said, it's not for me. So us as counselors, we don't have a set agenda, and we don't want to make cookie cutter people.
Right.
So it really is getting to know the person, how they think, what do they value. And then we're like, okay, if this is what you value, is this behavior kind of getting you to the person and the things
Right.
that you want out of life?
Yeah. So I'm curious, kind of as we kind of think about stigma, and we think about, so this is a podcast that'll that's, when we think about target audiences, I want everybody to listen, right? But definitely, these are people that are in counseling programs or research or any kind of field of psychology or mental health,
Right.
and just people in the community. So I'm wondering, from your perspective, when we think about what we can do as individuals to be a part of that destigmatization of mental health and those topics that we talk about, can you think of what do you think you can do as somebody working in the field, and then also as just somebody in a community that wants to move that forward of that acceptance around something that has been very stigmatized over the years?
Yeah. So I think that's a good question. So part of it is, I know Courage to Connect, we have the Out of the Darkness walk for suicide prevention. And again, since the pandemic, especially with the kids, we've seen a very big increase in suicide and other things like that. So, I mean, getting involved in those kind of walks can be a good way where you don't have to go out and be big about it, but you can just support, if that's not your thing, is to go out and preach or whatever to people. But I've noticed, even with clients or just your everyday person, just talking to each other more about it. It can take a while for people to get comfortable with that, and that's not for everybody to share what they're struggling with if they're not comfortable. But I've definitely had clients come in where nobody's been in therapy before, right? And then all of a sudden, eventually they might get comfortable talking about that, and then their family members are like, oh my goodness, you sound like me, I must have anxiety or depression or, and then I've just kind of seen sometimes families transformed, and they're like, okay, we can talk about this together, we can help each other through it, and particularly with families just because of the genetics,
I spoke to somebody else. I spoke to Dr. Patrick Corrigan, who does a lot of research in the field of stigmas and mental illness and mental health, around this idea that he was saying that the power of contact, so of just knowing somebody or communicating with somebody who is going through something,
right,
and people who are kind of coming out with their stories, the power of that to work towards destigmatization is pretty remarkable. I mean, he even says that it does more than like any kind of education or anything around there, of even just knowing somebody who that, you know, a loved one or somebody that in your life. What were you gonna say?
Yeah. Well, I think it's because like you get to know the person.
Yeah.
And then they share that with you.
Right.
And you're like, oh, you're not a weirdo. Or,
No, exactly.
You know, something like that. And it's like, oh, you struggle with that. Like, this is kind of normal to struggle in life.
Yeah.
And we can talk about that instead of it being, you know, hush hush or we got to be strong or.
Yeah. There's so many feelings that, and I'm not going to blame one thing, but there, of course, there's societal things from just people in communities or people within the media, all this kinds of stuff of like what anxiety looks like, what depression looks like, what different things look like, and as we talked about earlier, the way that we approach counseling in these sessions is like there's no one way, right? And
exactly.
and so everyone will experience things differently, but there is a sense of like, oh, this person that I know and care about or love is going through this. And if they open up about that, then like you said, somebody can identify with something about that and say, oh, you know, maybe it's not so scary to ask for help and to reach out, and understanding that the expectation is simply showing up on that first. I always talk to clients about that of like especially when somebody's in the room or on, you know, on the in the Zoom or there's something about that where I always like to acknowledge like this is a big part of this, like just the, you know, that in itself I don't think we take for granted when people do, you know, reach out for that help.
It's very nerve-wracking for them. They don't know what to expect. And,
yeah, exactly. And I think people are surprised sometimes that there isn't some sort of we don't have any kind of motive other than just work, you know, talking, exactly.
Trying to help,
So thanks again for taking some time.
Sure.
I've got a couple questions to kind of wrap up. But when you think about your career and you think about this field, which is one that, you know, a big thing that gets talked about is the idea of burnout, right? The big thing that gets talked about is you know, the things that especially in the work that we do, wanting to have the energy and the time for, you know, for our entire everybody that we work with and everything like that. What are things that you found to be, you know, helpful for you to kind of work with, you know, potential burnout or times that you felt like, you know, maybe even earlier on when you're like, or was there ever a time early on when you're like, I don't know if I can, if this is something I can do?
I think all counselors go through that at times. So, I mean, I think we talk about self-care with patients, right? And sometimes we just say it and don't do it.
Really?
But, is more time in this field, you do have to take care of yourself as a counselor, because that's where your creativity comes from. That's where, you know, your compassion comes from, and things like that. And then also, remember, we're human. I know a lot of newer counselors especially, like, I have to have all the answers, and I need my own behaviors in my own life. I can't have anything, you know, anxiety or depression or anything myself going on. But the thing is, we are all human. And we all are going to have tough times, even as counselors. So, I mean, many counselors, and I don't think the public knows this, is that we also go to counselors. You know? So, and I mean, again, it might not be anything's wrong in particular, but it's just a chance, like, to take some time out for you. Where's your life going? What are you struggling with? And we just all have these core beliefs about ourselves. That we get triggered by and need to work on for our own mental health.
It's funny you say that, because I think that about the us counselors having counselors of our own, of like if you heard that it's not exactly the same, but it's sort of like if you hear that like your primary care physician has a primary care physician, you wouldn't really, you'd be like, yeah, that makes sense. So it's sort of like
Right.
But yeah, and it's like if clients found out that we, it's just like, it's like, yeah, because that's, so I think that's an important thing to balance in there. I guess this is a question that can probably go in a lot of different. I'm curious to know what comes to mind, but what is it that what's the last thing in your job that surprised you? So like the last thing that, I almost don't want to give too much background in that question because I'm curious what comes to mind of just like, what is the last thing that surprised you about this line of work, about your job specifically, about just the work that you do?
Last thing that surprised me. You don't get surprised too much when you've been in this field for a while. I mean, I have been doing, we as counselors, we continue our own education and stuff in different fields, and I've been focusing more on trauma lately. So the last thing that surprised me, I guess, was just the body's and brain's own ability to heal itself. It's called, I believe, adaptive information processing. Right, and particularly with EMDR, it's kind of like the counselor needs to stay out of the way, so the brain can do its own,
exactly.
Yeah, its own healing process. So, just learning more about how the brain and body connect, and the brain can change, it can heal itself, given the right help. It just might be stuck. Okay.
Yeah. I like that's a great answer. It also ties into this idea of this continuing education, which it's something that excites me about going to this field of I'm not only I feel very fortunate to have understood this from really day one of when I first was getting my master's, about like I don't know everything by a long shot. I will never know everything, and that's exciting. I think there's different ways of looking at that where like, people might be like, I don't know. It's like, you don't know everything. It's like, great.
Yes.
So that means that every day you have an opportunity to like learn new things or be surprised or get excited, right? So, but yeah, I always feel very fortunate that we get to do the work that we do. Here at Courage and beyond. So
right.
Any last thoughts before we wrap up here, or anything that you want to tell the listeners of the Courage Speak podcast?
right. So just notice, like, talking about that last part, I am a supervisor here, so I do work with a lot of newer counselors, and I love that work. Because I think it is hard coming into the fields, thinking you're supposed to know everything, and how could I possibly know everything? And I just want to tell, just say, I don't know. I will look into that for you. You don't have to know the answers, nor will you ever have the answers. So you don't need to be an expert or come at it as an expert.
I think about that. I think that's such a great piece of advice for people that are myself, anybody that's in training and continuing, learning the job and all those kinds of things about, like, I remember the first time in a session I ever said, basically the I don't know, but like I like to, I'll learn that kind of a thing, and you think kind of, at least I thought beforehand that would be some scary moment.
Right.
And if anything, if there's one thing I've learned so far, at least a little bit, it seems like there's something about, like, we talk sometimes about how, like, clinicians can kind of model behaviors that, in session.
Yes.
It's kind of like modeling, like you said, we're human. It's modeling being that we don't always know things. In fact, we most often don't know things, right?
Yeah.
And that's okay, and that's not, that's just like an opportunity to learn, or just be okay with not knowing sometimes, to some extent. So, so Erin, really thank you again for joining the Courage Speaks podcast, and hope we can talk down the road too.
Sure. Okay. Thank you.
Thanks again to Erin for hopping on the show this week. New installments of Courage Speaks will be scheduled for release every third Monday, with the next episode set to premiere on October 30th, perfectly timed for you to enjoy during your Halloween trick-or-treating activities. As always, thanks to John Marikoski for writing and producing our beautiful theme music. Thank you for tuning in to Courage Speaks. We want to remind our listeners that the information and discussions presented in this podcast are intended solely for educational purposes. The content provided is not a substitute for professional medical advice, diagnosis, or treatment. It's important to consult with qualified mental health professionals or healthcare providers for personalized guidance regarding your individual situation. While we strive to provide accurate and up-to-date information, the field of mental health is complex and ever-evolving. The views and opinions expressed by the host, guests, or participants are their own and do not necessarily reflect those of Courage to Connect Mental Health Center. If you'd like to learn more about our practice, feel free to visit www.couragetoconnecttherapy.com. Until next time, for Courage Speaks, I'm your host, Sam Sherman.